Good morning, welcome back, and thank you for attending. Today I'm joined by Dr. Carol Zimbalati, public health physician, to give an update on our local COVID-19 situation, and Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, who will provide an update on our vaccine rollout. Before we proceed, I'd like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. We want to recognize the strength and dedication of Indigenous peoples, communities, and organizations across this land in reducing the spread of COVID-19 and supporting the efforts of public health. On March 3rd, we held our last scheduled press conference and mentioned that should the situation change or information need to be shared, we would be back. That is what brings us here today. As we know, Ontario is well into wave 6 of the pandemic. This wave is driven by the more transmissible sublineage of Omicron, BA2. The increased transmissibility, coupled with waning immunity and lifting of public health measures, have resulted in an increase of COVID-19 cases locally and provincially. On April 14th, the Ontario Science Table released their most recent COVID-19 projections, indicating there is uncertainty around the impact the increase in cases will have on our health system and the number of deaths expected, though they expect hospitalizations in the 6th wave will not equal the large number in the 5th wave. The province has expanded eligibility for PCR testing to anyone 70 and older, people 60 and older with fewer than 3 doses of a COVID-19 vaccine, and people 18 and older with fewer than 3 vaccine doses and at least 1 risk factor, such as a chronic medical condition. This expanded eligibility is intended to increase access to antiviral treatment. The antiviral treatment is not prescribed or administered by public health. Treatment is available for COVID-positive individuals if they meet eligibility criteria. The best way to determine eligibility is speak to their primary care provider directly, or if in the North Bay area, call the Assessment and Treatment Center at 705-474-8600, extension 4110, and follow the prompts to speak with a nurse screener. In West Parry Sound, the Assessment Center can be reached at 705-746-4540, extension 5030. They will help with determining eligibility for testing and access to medications. It is difficult to know exactly where we stand in our district with respect to COVID-19. Case counts are no longer an accurate reflection of COVID-19 burden or impact. Case counts have been quite variable in our district over the past weeks and days. Percent positivity can be a helpful indicator, but it is influenced by a number of PCR tests being completed. Percent positivity has also shown significant variability, especially locally recently. Hospitalizations, ICU admissions, and deaths are important indicators, but are significantly delayed from the onset of infection. Reacting to lagging indicators such as this may mean the actions are taken too late to respond effectively to threats posed by COVID-19. The science table stated that provincial wastewater surveillance suggests that community transmission may have peaked. Local wastewater testing is only available in the City of North Bay and therefore does not provide a wholesome depiction of the presence of SARS-CoV-2 virus concentrations for the entire health unit district. At this time, it is unclear if our health unit district has peaked or not. Regardless, the projected peak does not mean we can let down our guard. It is important that we layer our protection against COVID-19. These include a strong recommendation to continue wearing a well-fitted 3-layer mask or the use of a medical mask in all public indoor settings. Please continue to respect the ongoing mask requirements, including in hospitals and in other healthcare settings, long-term care homes and retirement homes, congregate care settings, that provide care and services to medically and socially vulnerable individuals, such as children's treatment centers, in shelters, public transit, as well as the federal requirements for returning international travelers. Though most COVID-19 infections result in mild illness, there are a significant portion of people who experience severe COVID-19 illness, as well as many who experience ongoing symptoms for weeks or months following infection. Both poor outcomes are certainly not exclusive to unvaccinated individuals, but more common in those who are not up to date with the COVID-19 vaccines. Therefore, you are encouraged to stay up to date and get your 4th dose of COVID-19 vaccine if eligible. Ontario recently expanded the eligibility criteria for 4th doses. It is recommended that people 60 years of age and older receive a 4th dose or second booster dose 140 days after their last dose. This also applies to First Nation, Inuit, and Métis adults and their non-Indigenous household members 18 plus. Now I will turn it over to Dr. Zimbalati.
Thank you, Dr. Chirico, and good morning, everyone. As of yesterday at 3 p.m., there were 20 individuals in the hospital with COVID-19 from our district. 7 of those individuals were in hospital due to COVID-19. Unfortunately, since our last press conference on March 3rd, 7 individuals have passed away due to COVID-19. According to Ontario's Science Advisory Tables dashboard, there are about 1,691 individuals in hospital due to COVID-19 throughout Ontario. This is an increase of 24% in the past week. The local percent positivity of PCR tests completed has fluctuated since the beginning of the year, with the highest percentage positivity recorded on February 27th at 20.12%. There is a testing lag for our percent positivity data. Our most recent information indicates an 18.1% positivity on April 20th, whereas Public Health Ontario posted a provincial percent positivity of 16.8 on April 19th. We can't draw any meaningful conclusions from the local percent positivity since the fluctuations are continuing, other than to say that it still remains higher than the percent positivity recorded in 2020 or 2021. This means that COVID-19 continues to circulate in our communities, and it's important to remain vigilant. We recommend layering protection to help prevent the spread of COVID-19. This includes masking in indoor public spaces, remaining up to date with vaccinations, frequent hand hygiene, and self-isolating if you are ill, even if you were negative on rapid antigen testing. Since our last press conference, the rules for self-isolation have changed. Household members of a case or symptomatic individual, as long as the household contacts are fully vaccinated and are boosted if they are 18 and older, are no longer required to self-isolate as long as they don't have symptoms. However, they are required to wear a face covering in public for 10 days following their last exposure to their ill family member, and if symptoms develop, they need to self-isolate immediately. If you have questions about whether or not you need to self-isolate, you can always call our call center at 1-844-478-1400. To switch gears a little, I would like to take this opportunity to highlight some of the work the Health Unit has been doing in the community to decrease infection spread in high-risk settings. The Health Unit's Infection Prevention and Control Hub, which is a Ministry of Health initiative also known as the IPAC Hub, has supported over 25 congregate living settings in our district with infection prevention and control guidance. Congregate living settings include long-term care homes, retirement homes, group homes, and shelters, among others. These settings house individuals who are at high risk of severe COVID-19 illness. IPAC measures to prevent and/or reduce the risk of spreading an infection between residents, visitors, and healthcare providers in these settings. The support the settings received will also serve them beyond the pandemic, as they are now better prepared to prevent or control the spread of many other infectious diseases. Now back to you, Dr. Chirico.
Thank you, Dr. Zimbalati. Now I'll turn it over to Shannon Mantha, who will give us an update on immunizations.
Thank you, Dr. Chirico, and good morning, everybody. So as of yesterday at 3 p.m., 3,953 children aged 5 to 11 have received at least one dose of the COVID-19 vaccine. This represents about 46% of 5 to 11-year-olds in our health unit district. This still remains lower than the provincial rate of 56%. We continue to encourage parents to have their children vaccinated against COVID-19 by making an appointment or walking into any clinic in your area. Parents can book an appointment at ontario.ca/book vaccine or by calling the health unit's call center. As Dr. Chirico mentioned, many individuals are now eligible for their 4th dose, which is also commonly referred to as a second booster dose. So as he mentioned, 6 individuals 60 years of age and older are eligible, who received a 3rd dose are eligible at least 5 months after that dose to receive a 4th dose. 4th doses are also available to First Nations, Inuit, and Métis adults and any non-Indigenous household members of theirs who are 18 plus who received a 3rd dose 5 months ago. There are also some previously eligible groups, and those groups are for 4th dose. Those groups are adults age 18 years of age and older who are moderately to severely immunocompromised, youth between the ages of 12 to 17 years old who are moderately to severely immunocompromised, who received a 3-dose primary series, residents of long-term care homes, retirement homes, elder care lodges, and older adults living in other congregate care settings, providing assisted living and health services, as well as adults 18 years of age and older who have proof of immunization and have received 3 doses of any non-Health Canada authorized vaccine, COVID vaccine, at an appropriate interval. So to date, 4,567 people have received their 4th dose in the North Bay Parry Sound District. Knowing that COVID-19 vaccine protection decreases over time, coupled with the increased local transmission, I encourage everyone to stay up to date on their COVID-19 vaccines by receiving all the recommended doses. To support access to the vaccine, several local pharmacies offer the COVID-19 vaccine, and the health unit continues to offer scheduled appointments as well as walk-ins at vaccine clinics across the Nipissing and Parry Sound districts. Individuals can book an appointment at ontario.ca/book vaccine, or you can call the health unit's call center at 1-844-478-1400. Thank you, and now back to you, Dr. Chirico.
Thanks, Ms. Mantha. So that ends our remarks, and we'll take your questions now. If you can just put them into the left of your screen and associate your name with them, and I'll turn it over to Ms. McDermott to take the first question, please.
Thank you. So our first question is for yourself, Dr. Chirico. It comes from PJ from the Nugget. Are there any indications at this time that masking mandates or similar measures may be imposed either locally or provincially?
Well, thanks for that question, PJ. No, there aren't any indications that the government is going to reverse their decision and impose any mask mandates. What we are trying to do is advocating to keep the measures in place for high-risk settings that are due to expire April 27th and advocate to have those extended, especially for those high-risk populations.
Thank you. Our next question is for Dr. Zimbalati. It comes from Eric Thompson. Though local wastewater testing isn't available throughout the district, does wastewater give a better understanding for how prevalent COVID-19 may be in North Bay compared to PCR testing? And then a second part to the question is, what does the wastewater data show?
Those are both very good questions, and unfortunately, I think both of those indicators are difficult to interpret in our setting because of one, in terms of the PCR tests, the eligibility for the PCR tests, and with respect to the wastewater data, the variability that is involved in those measurements. It just makes it very difficult to interpret and doesn't necessarily correlate with other indicators that we follow. So I wouldn't say that we can really rely on either. Of course, we continue to track both, just to follow those metrics. And can you remind me of the second part of the question, Alex?
Perfect. The second part of the question is, what does the wastewater data show?
As I said, and thank you for the question, it is highly variable. We have dramatic peaks and spikes within a matter of days, so and then valleys. We have shown a recent spike in the early part of April, which decreased, correlate with other indicators that we try to follow, and we can't hold a lot of stock in the wastewater data as it's presented.
Thank you. Our next question is for Dr. Chirko. It comes from Chris Dawson from Bay Today. Dr. Chirko, what is your most important message you're sending today?
Well, thank you for that, Chris, and I apologize if we presented so much that I got lost there. My fault. But thank you for raising that, because what I'm really trying to get across is this wave isn't over yet. We don't know if we've peaked. And the best way to protect yourself, as well as those around you, and our healthcare system, is to be up to date on all of your immunizations and to continue to use masking, as we've described. Those are the best ways to really get through this wave, and hopefully, things will ease off over the next couple of weeks as predicted.
Thank you. Our next question is also for you, Dr. Chirko. It comes from Eric Tashner from CTV News. What is the difference between this current 6th wave of the pandemic compared to the past waves we've gone through?
Yeah, very good question, Eric. I think that the difference is, and we can actually extend it to, when we first had Omicron, I think the biggest game changer has been immunizations. And the rapidity in which we were able to get safe and effective vaccines into people, and mass immunizations, when you think of the enormity of what we've accomplished. And I think that has shown to be so effective in preventing severe illness, hospitalizations, and deaths. So I think with that, and I think you also have to combine the difference, like when you say from the last wave, is that with this variant, it was so much more transmissible. So many more people acquired the virus, and with immunizations and with natural immunity, far more of the population developed some immunity to the very transmissible Omicron variant. So those would be the biggest differences.
Thank you. Our next question is also for you, Dr. Chirko. It comes from PJ from the Nugget. Of the 31 deaths attributed to COVID-19 in the region, is there any indication how many had not been vaccinated?
I don't have the information of the 31 as to what percentage is, but we can follow up with that. And I think you have to be careful interpreting that kind of information as well. You have to be very clear that it's a lagging indicator, and more information is required to determine, was it a direct cause from COVID-19, or did they have the infection? And there were other illnesses that they had associated. And similarly, the age is an important factor too, and all the other health conditions that they may have had.
Thank you. Our next question is for Shannon. It comes from Sarah Bissonette from the Parry Sound /Almaguin News. Why do you think there is such a lag, a local lag, in children aged 5 to 11 being vaccinated? Are there any concerns that this poses to the school system?
Yeah, thanks for that question. And, there's a bit of an echo I'm hearing. Dr. Chirko, can you mute maybe? Yeah, sorry. Great question. And this is something we talk about often here at the health unit because we are very cognizant that our coverage rate for 5 to 11-year-olds is quite a bit lower than the province and as well as some other health unit districts. So, I mean, I'll start off by saying it's very important for 5 to 11-year-olds to be vaccinated against COVID-19. We continue to provide opportunity at, clinics across the district. We're having clinics in schools after hours to make it convenient for those in the neighborhood who attend a neighborhood school to be vaccinated. Additionally, one of the factors I think that plays into this, there's a couple of factors, but one of them is that, there is a myth maybe around with parents around children who have already had COVID-19 vaccine or COVID-19 infection that they don't need to be vaccinated because they already have immunity from that infection. And so what the evidence shows and what we know from science is, even if you've had a COVID-19 infection, you should still get vaccinated to protect yourself from getting infected again. So while infection alone provides some immunity, vaccination after infection helps improve the immune response and makes it last just a little bit longer. So there is some hesitancy with parents to vaccinate this age group. And I think the best way to address some of that hesitancy and parents who are looking for information is to reach out to and look for some resources. So we have lots of resources available on our website that are evidence-based. You can talk with your primary care provider if you're having, you have questions or you're not really sure. And you can also, there's a really great service out of Sick Kids, and it's a telephone and online service. So it's called Sick Kids Vaccine Consult Service, and you can speak on the phone with a pediatric nurse who will answer all your questions so you can make an informed decision about whether or not to vaccinate your 5 to 11-year-old. In terms of the last portion of that question, the impact on the school system, I mean, as Dr. Chirico and Dr. Zimbalati and I have talked about throughout the press conference, being vaccinated remains our #1 best defense against COVID-19, and then layering that protection. So definitely, if there's large groups of unvaccinated individuals in schools, it will have an impact. But I mean, we still continue to promote vaccine and then layering your protection with masking and all the other public health measures that we know make a difference to slow and stop transmission.
Thank you. Now, our next question is for Dr. Chirico. It comes from Eric Thompson. Does the health unit have the authority to extend the mask requirement in local healthcare settings if the province doesn't extend it past the April 27th deadline?
Well, thanks for that question, Eric. And first of all, I believe that if it's going to continue beyond April 27th, that should be a provincial mandate throughout all of Ontario by the government. The Section 22 orders were not designed for this. Early in the pandemic, when we had to use the Section 22 orders for the mask mandate, it was a different scenario, and that was the only legislative course that we had at the time. Currently, letters of instructions that medical officer health could have used in the past are no longer available to be used as the Reopening Act for Ontario has been repealed. So to use the Section 22 order for that now would not be, in my opinion, an appropriate legislative tool to use. Would be essentially unenforceable given our current situations, and there are criteria within the Health Protection and Promotion Act specific for Section 22 orders that have to be met, and I do not feel that they would be met in the current situation.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Clark from YourTV/Cogeco. Are you concerned with the rollback of provincial health restrictions in the 6th wave?
Yes, it's for sure. We've seen increasing number of cases as a result of that and lifting of the mask mandate, and we are seeing more and more cases. And the most important thing and again, it's not a criticism, it's just you're trying to find the balance of balancing restrictions, keeping people safe, and keeping the economy going, and trying to get back to more normal life. And that's a difficult balance to find. However, it has impacted people and impacted our healthcare system, but we're coping. We are working with our healthcare partners, and everybody, each individual has a role to play in that to ensure that you are up to date in your vaccinations, and to follow what we've already described with respect to masking. It's easy to follow. It has been shown and to be effective, and the science table has indicated that along with masking and ventilation changes to indoor settings is very effective against transmission. So doing those things, I think, are really still very much measures that we need to put into practice.
Thank you. Our next question is also for you, Dr. Chirko. It comes from Eric Tashner from CTV News. Dr. Moore said in the past that mask mandates could be extended in at least until the end of May if needed. Mandates in long-term care homes, hospitals, and other high-risk settings end on the 27th. If there's an extension, how long would you recommend it for?
Yeah, that's an excellent question. And it's one that I don't think anybody really has the answer to right now. I think like throughout the entire pandemic, we've had to be very nimble and flexible and see what the evidence is telling us. If we are seeing that, in fact, what we've experienced in previous waves is that 4 to 5 weeks up, 4 to 5 weeks down. And if we're on the latter end of that, we're seeing decreasing cases. We're not seeing hospitalizations or increasing deaths, and things are moving all in the right direction, then I think that will inform the decision to be made. And again, it needs to be made provincially, but that evidence would inform the decision to relax the mask mandates. And hopefully when that happens, we will be able to ease up on those type of restrictions very quickly.
Thank you. Our next question is for Dr. Zimbalati. It comes from PJ Wilson from The Nugget. Is there concern about the number of staff/students isolating due to COVID? Land of Lake School had to close for at least 1 day due to staff shortages. Is that a concern?
Thank you, BJ, for the question. Obviously, any interruptions to the education of students and their ability to attend school is of concern, especially because in the past 2 years, they have endured so many interruptions already to their education. And really, the way to address this is through everything that we've been highlighting so far in this press conference in terms of the layering of protection. And this applies to the school community setting as well in terms of remaining up to date with vaccinations, layering that protection with well-fitting masks, and hand hygiene, staying home when ill. All of those sorts of protections are important so that students experience as few interruptions to their education as possible.
Thank you. So that concludes our submitted questions. So thank you very much for attending the press conference, and we will be back when needed in the future. Thank you.